So I think to start off with, whenever we talk about healthcare, it's important to remember three kind of big facts. One, we all know we rank low in indicators of health and health status. We know we have a high poverty rate, near 20%, and we know that the percent of non-elderly Louisianans without insurance is near 25%. The elderly, of course, have Medicare, but for those of us who are not 65, it's a bit harder to kind of go. So, Medicaid in a state like that is crucially important. Right now, about 1.2 million Louisianans, about 27% of the population, receives Medicaid. And, the majority of those are children. 60% of all people on Medicaid are children. The remainder are people with disabilities and low-income adults make up a very small fraction of that. So, really, Medicaid, when we talk about healthcare in Louisiana, has to be part of the conversation. 1 in every 5 healthcare dollars is a Medicaid dollar. So, it's a huge thing. So, now I thought I'd talk a bit about Medicaid and the budget. So, Medicaid is probably one of the largest programs in the state budget, and that's one of the reasons that whenever a budget shortfall happens, we talk about Medicaid and healthcare cuts. So, the Medicaid program is about $6.7 billion. Sounds like a lot of money. Huge piece of the budget. The budget's $25 billion. Healthcare, Medicaid, $6.7 billion. But what isn't always talked about is that most of that's federal money. About 70% of the Medicaid budget is federal money. Medicaid's a unique program through this federal-state matching. So for every dollar state government spends, the feds reimburse 70 cents of it. So, that also, if you think about it, makes Medicaid cuts especially harmful because, if the state government cuts $100 million out of Medicaid, they really only net $30 million in state savings. That other $70 million just goes back to D.C. and doesn't come here to be reinvested in healthcare. So it's a very costly way to cut the budget. But unfortunately, with the persistent budget shortfalls we're seeing, we seem to keep coming back to that. We saw that again as last week House Appropriations cut another $100 million out of the Medicaid budget.